Hi, my name is Dr. Chong. I'm the medical director at San Joaquin. In this teaching, I like to introduce OMT, or osteopathic manual therapy. I've been practicing this for the last year and incorporating this into my medical practice as well as my practice here at San Joaquin. And what it does is that it improves pain management without medications or an injection. It also improves range of motion, strengthening, and actually overall what I find when I work with the therapist, both the OT-PT, is that it actually improves their rate of recovery or function. So I've been experimenting this and I think it works really well. So today I kind of want to do a demo on you, and I'm going to use Diana here as a demo. And I think instead of explaining the mechanism of action, because I think the mechanism of action is not clear, and from my reading and understanding of this, it is, I don't think the science is really there yet, but the concept is that when we give medication, we cause a chemical transduction to the interstitium, or to reduce the inflammatory markers, whether it's cytokines, interleukins, and so forth. But with this type of manual therapy, it is believed that we can induce the same state through a mechanical transduction, not a chemical one. So, I mean, as a physician, if you can do the same thing without introducing something foreign into the body, it's just another tool that we can use. So I'm just going to let my demonstration, it speaks for itself, and and the result is what I call in American medicine, because the result is instantaneous. You get instantaneous result, and then you also have gradual improvement. So I don't recommend, by doing this, it's like any type of therapy, you have to allow the body to adjust, although you do see instantaneous changes. So the best way to do is, let's just go at it and we'll go from there. Looking at Diana, you can tell that she has back issues. She's just lost the lumbar curvature. Her shoulders is a little bit asymmetrical, so something's pulling there, okay? So, well, from this examination point of view, so I'm just gonna let her do her own function and you kind of judge for yourself. So the first thing I want you to do is, Diana, I want you to kind of slowly bend forward and try to touch your toes. And see how low she gets. And I want her to feel how much pull you have, okay? And how you feel. And so when we finish this, we'll just now stand up slowly. Okay. So that's I hope you can see that. And just slowly do it again so everybody can see how much effort you're trying to put into it. And then we're going to do the manual therapy. So what I'm going to do is just, since we don't have a lot of time, I'm just going to do the cranial portion. And part of that is, I'm going to take off your glasses, is that it works as a shotgun. And what we find is certain points on the cranium actually mimic certain region of the body. So let's do a straight leg raise here to see how far we can go. And look at Diana, she gets to here and it gets tight, okay? We'll do the same thing on this side. She gets this side, not as good as the other side. It gets tight around this area, okay? So I want you to lift this up, and I want you to keep it up, okay, Diana? Keep it up, keep it up. I'm gonna push it down. Just resist against me. You see how easily I can break her. You can't really do this if you have normal strength. Keep it up and let me break you. You see? I can easily break her. Okay? So what I want you to do is, I want you to kind of resist against me. Okay? I'm going to push her leg this way. You see? I can easily overpower her. And I'm going to push this way. Resist me. See how I can easily overpower her? And stabilize and easily overpower. So I'm going to do basically 4 points. One of the points I'm going to do on the cranium is called the nasal point, and this is basically, it's a general relaxation in manual therapy. You need to get the patient to relax. Okay, so it's just a quick point. we're going to do 3 other points for that. One is the, it's called parietal 1 because it's located on the parietal cranium area, and parietal 2. And those usually controls these sets of muscles. And just so that Diana can feel better after this, we're going to also release the neck and the shoulders as well. And we'll do a coronal on that. So it'll be a really quick demonstration. So let's start by relaxing her. So this is what we call the nasal point. And anybody can do this. You can do this if you can't fall asleep at night. I usually use these for people to fall asleep. And it works very similar to melatonin. It just kind of relaxes you. So what I do is, it's a very gentle press. So it's just like cooking. You just feel for the stiffness, which side is stiff. And you just press from the softness to stiffness. It's a very gentle press. And one thing I really like, this is what we call indirect manual therapy. You've gone to the masseuse, and they do more direct. This is indirect. The thing about the indirect is that it requires a whole lot more training. But the good thing about it is that, I mean, I'm not the biggest guy in the world, so I can do this with people who are very muscular without wearing them down. Can you imagine doing about 5 to 10 patients a day and trying to overpower them? I mean, I can't last that long. That's what I like about it. So now Diana's probably starting feeling it now. So what I do when I do this is that as a therapist, I can feel that she is actually starting to relax. And the reason for that is I feel a pulse in where I'm pressing. And the pulse is, I'm not quite sure what it represents. Maybe a release of tension. I don't know. But it's different from a cardiac pulse. And you just let the pulse go. And once you get there, you feel this pulse, and it's just going to relax, 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 relax. And you basically hold there from anywhere between 45 to 90 seconds or less, depending. And that's usually what Dr. Jones, who created these techniques or discovered it, he's a DO, and that's how we're trained. So, but there are ways that you can augment it. You can do it a lot faster if you make certain people do certain things. Okay, so we got the nasal point. So she's pretty relaxed now. Most of my patients, when I do this, they might start snoring on you when you start doing this. So the next one is we're going to look at just the 2 points that we're and the coronal point. So we're going to look at the parietal. So you just find on their cranium, and you just ask them. This is parietal 2, and this down is parietal 1. So I'm going to say, I'm going to find a little divot and say, does this hurt or does this hurt? Which side is more tender? Your right side. So for Diana's the right side. So with the 3-pole technique we're going to use on this is that you go to the side that is more tender. So you kind of turn this way a little bit, and you do a 3-pole technique. So it's it's an anterior cephalo pull. She's pretty good with that. Cephalo, straight up and back. So she's more sticky on the back. So what you do is that you go to the side that is the least resistant, and this is why it's called indirect. So, I mean, as you can see, I am not pushing and pulling at all. It's very minimal. And the other thing is that there's a lot of longevity. If you practice this, is that you can be 70 or 80 and still practice it. Because all you have to do is lay them down. So, I'm starting to feel the pulse already. And I can adjust this with just like barely moving my hand. And I want to get the most pulse. Now, so how you test is, do you still feel tenderness or just pressure? Just pressure?
Just pressure.
Okay. So if she feels tender, you will ask what percent improvement, but she's not feel pressure. So basically, I hold on for another few more seconds. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. And I slowly release this point. So we've got 1 point. So let's do the second point. So the parietal 2. So these landmark, you're gonna just have to take the class and then, or be with an experienced person. They'll show you how to find it. So tell me where it hurts the most. A little bit stiff on this side, a little softer on this side. Which hurts more? left or right?
My left.
So now she hurts more on here, so you just got to turn this way a little bit. It's very gentle. So you keep your finger where it is. And, so you do a 3-pull technique. Find which side is the least resistance. But you got to pull the cephalo, posterior, cephalo, and anterior. So I'm finding that the anterior, she kind of likes the anterior more, so I'm just going to go this and adjust. So what I'm trying to adjust when I talk about adjustment is that I'm trying to find a point that it is, that she kind of like release all the pressure and at the same time you start pulsing right away. So it's that point. So you just adjust as you go along, and she's going to start pulsing now. Okay, so you just hold it. And you can test her to see if is it still tender or it's just pressure. Is it tender?
Just tender.
Okay. What percent has it improved by? 0 to 100%? 50, 60, 70?
Like 50%.
Okay. 50% means you're about two hair breadths away from what you're supposed to be at. So in this case of manual therapy, 50% is really good. It's you're almost there. See, now I just kind of twisted a little bit, and you probably don't see it, but I just moved my shoulder just a little bit in a different direction. Now she's pulsing again. And she is pulsing, pulsing, pulsing like crazy because I can feel it. And can you feel that?
Mm-hmm.
Is it pressure or tender?
Pressure.
Okay, just pressure. So we're going to hold there for a few more seconds since we got it. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. And we slowly release. So we're done with the two parietals, and we're doing coronal to release her shoulders. This is a coronal point, and this is a different technique that you use. So does this hurt tender here or tender here, or which side is more? More tender. A little more stiff on this side, not as stiff on this side. Feel pain? Tenderness?
Just tenderness.
On which side? This side or this side? More.
My right.
Right is more. So and this is kind of like a one-finger technique. So basically you press on the side that is less tender because you don't want to hurt your patient. So then you basically feel the pulse again. Okay. Just feeling I can feel the pulse. And the way I adjust is just, you see how slightly I'm just moving. Not moving much. So I said, is it still tender? Okay, so it's just pressure, so we're going to hold for the next 10 seconds. 10, 9, 8, 7, 6, 5, 4, 2. So we're actually done with treating her. Now let's see the results, okay? And this is the part that I said, it's instantaneous. So remember we did this part? And you're just going to let go. I'm going to raise up, raise up, raise up, raise up, raise up. Okay? We're going to do this side. This side was a little bit less than this side. So, raise up, raise up, raise up, raise up, raise up, raise up. Okay, that's pretty good. So this is just range of motion. Let's see strength. Keep this up, Diana. Just keep it up. Resist me. You see that? I'm not acting. This is real. Okay? Let's try this side. Keep it up. Okay, I'm not acting. Okay, so you remember, I'm going to pull you. You're going to go this way. I'm going to pull you. Don't let me pull you, okay? See? I can't break her. Okay, slowly touch your toes. There you go. How did you feel, Diana?
I feel good.
Do it again slowly. And you see how she can get to her toes much? It's almost like 2 or 3 inches more. 2 inches at least. And she's not straining. I don't feel the strain anymore. So the thing you will do, you tell people after you counter strain them, you tell them make sure you drink plenty of water in the next day or two, because 10% of the people will be very sore, like you're running the mile without stretching. Okay, so you tell them to drink plenty of water, and that's one of the side effects that you have with it. So I'm hoping, and you can do this not only for back, you can do for shoulders, headaches. A lot of people think that headaches or migraines, you can counter-strain them. It takes seconds to take the pain to go away. You can do knees, ankles, hands, elbows. A lot of frozen shoulder, you can release it within like 3 or 4 minutes, and they'll have the range of motion right back, and their pain will go away too. Now the thing is that, does it stick? Does it last? Well, in order for you to last, you got to make sure that the pathology here is not something else involved. So therefore, when I do this, I have to scan them, their whole body. It can take a few minutes, like 5 minutes to scan. So you'll find out, and you want to start releasing centrally first, and then moving yourself peripherally. So in your neck headaches and shoulder problems, you want to release your thorax and then your rib cage. Just think of it like a building. When you're building a building, you got this thing that's a pole, and you're hanging everything on it. You fix the pole first before you fix the stuff that's hanging on it, because you fix whatever's hanging on it, it's gonna go right back again because you never fixed the pole in the first place. In the lumbar area, fix the pelvis, the iliacus muscle, and then go to the lumbar. Determine whether it's anterior or posterior. Most of us will never compare, I got front pain. You hardly ever hear that. You're going to say, I got back pain. So, and you said, oh, by the way, can you say, where's your back pain? And they go, this. If it's a diffuse thing, it's usually a front pain that causes back pain. And if they say localized in the back, it's usually a back pain that's the back. So it's the posterior side. And these are some of the history that you need to take. And it goes for both neck, chest area, it goes for back, and there are a lot of breakthrough with this type of counter strain, and they're moving on to like counter strain of visceral organs and so forth, whether it's kidneys, whether it's heart and so forth, or a liver, and it may help. And I find that one of the ones that I did on the fascial counter strain is the iliac veins, is that it reduces swelling, and a lot of people had like numbness on the feet, and as a physician, we always said peripheral neuropathy, but we never really look at it. So sometimes vascular congestion can present itself as numbness. It may look like a glove and stocking loss too. So these are some of the stuff that we need to look at as physicians, and the best way to look at this is that there's no drugs and no needles. It's just time, and it's just talking to your patient and actually finding out where the problem is. And, well, I hope this is a really, you gain some from this, and I think I'm going to incorporate this into my practice a lot more, and each day I'm just adding more and more organ parts to it, and I get a lot of good results. And the best part is your patient walks out of the room that you are within with them, and they walk out feeling much better. And I mean, I don't know, I don't understand the mechanism of it, but if they're walking out there much better, their range of motion is better, their strength is better, they feel better, and I haven't given any meds or any injections or anything like that to them, I think that's a very good, it's something that we need to explore as an option. Okay, thank you.